Top 7 best fruits for diabetics to lower blood sugar levels naturally. Many people with diabetes have been misled into thinking they must completely avoid fruits even though their sugar content is completely natural. Fruits contain so many great compounds that are absolutely necessary for diabetes health, so you should not be missing out. Instead, you should be eating specific fruits that can even help you lower blood sugar. Well, there is a scale that measures how quickly a fruit raises blood sugar levels after eating. It's called the glycemic index, GI, and ranges from 0 to 100. Foods with a low GI, 55 or below, are absorbed more slowly and cause a slow increase in blood sugar. Medium GI foods, 56 to 69, cause a moderate rise in blood sugar, while high GI foods, 70 and above, lead to rapid spikes in blood sugar. So it's important you choose a fruit with low GI rather than just believing in myths and hearsay. But if you eat too much fruit, even with low GI, it can still spike blood sugar. The complications like retinopathy, neuropathy, nephropathy, Y vasculopathy due to diabetes are actually due to rapid sugar spikes. So to help you out, we have researched about the best fruits that meet all the criteria to be included in your diabetes diet plan. Let's start with number 1, kiwi. Kiwi is a fascinating fruit with amazing benefits for people with diabetes. Did you know it has a low glycemic index around 50? That means it releases sugar slowly into the bloodstream, making it ideal for keeping blood sugar stable. The fiber in kiwi, about 3 g per 100 gram, is a big part of why it works so well for this. It slows digestion and carbohydrate absorption so you don't get those annoying sugar spikes. Another reason kiwi is great is because of its antioxidants, especially vitamin C. Just 100 grams of kiwi gives you around 92.7 milliliters of vitamin C, which is more than enough for your daily needs. This vitamin not only boosts your immune system, but also helps protect your cells from oxidative stress, a problem diabetics often face. Plus, there's a new in kiwi, a compound that improves how your cells use insulin. It's like giving your body a little extra help to handle sugar. Now let's get into some research. A study published in Diabetes Research and Clinical Practice showed that eating 2 kiwis daily helped reduce blood sugar spikes after meals. Another study in Nutrients focused on inositol in kiwi and found it can improve insulin sensitivity, which is a game changer for type 2 diabetics. These studies make it clear kiwi isn't just delicious, it's science, scientifically proven to be effective. If you're wondering about the actual nutrients, here's the deal. Along with vitamin C, kiwi is rich in potassium, 312 milliliters per 100 gram, which helps regulate blood pressure, a bonus for diabetics who often need to watch their heart health. It's also got about 17 mg of magnesium, which supports insulin function and blood sugar control. Want to get the most out of kiwi? Try eating it with its peel. I know it sounds weird, but the peel is packed with fiber and antioxidants. Just wash it thoroughly to remove any pesticides. If that's not your thing, you can slice kiwi into salads with leafy greens and nuts or blend it into a smoothie with chia seeds. Another tip is eat kiwi 30 minutes before or after a meal to help regulate the glycemic load of your food. If you want to add any info in this, please comment. We also need subs so that we can continue to provide better information for you. With this, let's move to number 2. 2, apple. Apples are an excellent choice for people with diabetes, and they bring so many benefits to the table. It has a low GI around 50, which means they don't cause those spikes in blood sugar. Their magic lies in their fiber content, especially soluble fiber like pectin, which slows down digestion and the absorption of sugars. This gradual release helps stabilize your blood sugar levels and keeps you feeling fuller for longer, which is a big plus for managing cravings. Did you know that one medium apple contains around 4 g of fiber? That's impressive for such a simple snack. It's also packed with antioxidants like cotton-kin and chlorogenic acid. These antioxidants aren't just good for your overall health. They specifically help with diabetes by improving insulin sensitivity and reducing inflammation. And of course, apples are a great source of vitamin C with about 8 mg in a medium fruit that adds a nice boost for your immune system while fighting oxidative stress. The way apples work with your body is fascinating. When you eat one, the pectin and the fire fiber forms a gel-like substance in your gut. This slows down how quickly carbs are broken down and absorbed, keeping your blood sugar steady. On top of that, the flavonoids like cotton can enhance the way insulin works in your body. Essentially, it helps your cells use glucose more effectively, which is exactly what you want when managing diabetes. I came across some interesting research about apples and diabetes that you might find helpful. One study published in the American Journal of Clinical Nutrition found that people who ate one or more apples daily had a 28% lower risk of developing type 2 diabetes. That's largely thanks to the cortin and other antioxidants in the fruit. Another study, this one from the Journal of Medicinal Food, looked at the benefits of eating apples with the peel. It showed that the peel contains concentrated antioxidants that significantly reduce blood sugar levels after meals. So if you're peeling your apples, you might want to rethink that. When it comes to portion size, moderation is key. A medium-sized apple weighing about 150 grams is ideal. It gives you around 77 calories, 21 Gs of carbohydrates, and 4 G of fiber. That's a perfect amount to enjoy without overloading on carbs. Just one a day can do wonders for your blood sugar and overall health. If you're looking to get even more benefits from apples, there are a few tips worth trying. Always eat the apple with its peel. That's where most of the fiber and antioxidants are found. Pairing an apple with a protein or healthy fat like a handful of almonds or a bit of peanut butter can help slow digestion even further and keep your blood sugar steady. Also, whole apples are a much better choice than apple juice, which lacks fiber and can cause sugar spikes. And if you like variety, try adding diced apples to oatmeal salads for an extra dose of nutrients. 3. Guava. Guava is a fantastic fruit for diabetes management due to its unique nutritional profile and low glycemic index of almost 20. Its essential nutrients work synergistic to support blood sugar control. Guava not only helps in maintaining stable glucose levels, but also offers a wide range of health benefits for diabetes. One of the key features of guava is its high fiber content. A 100-gram serving of guava contains about 54 Gs of dietary fiber, which slows the absorption of sugars in your bloodstream. This helps to prevent blood sugar spikes and promotes a gradual release of energy. Guava is also a great source of vitamin C, with a single guava providing over 200 or more than twice the recommended daily intake. Vitamin C not only boosts your immune system, but also reduces oxidative stress, which is often elevated in people with diabetes. Guava leaves are equally beneficial and have been studied for their anti-diabetic properties. Compounds in guava leaves such as cotin and flavonoids help inhibit enzymes that convert carbohydrates into glucose, effectively reducing blood sugar spikes after meals. Drinking guava leaf tea after a meal is a popular method to harness these benefits. Studies published in journals like Nutrition Metabolism have shown that guava leaf tea can reduce post-meal blood sugar levels in diabetic patients. The fruit's potassium and magnesium content also play a vital role in diabetes management. A 100-gram serving of guava contains about 477 milligrams of potassium and 22 milligrams of magnesium. These minerals help regulate blood pressure and support nerve and muscle function, which is beneficial for diabetics and reduces the risk of cardiovascular complications. Research has provided significant evidence of guava's role in diabetes care. For instance, a study published in the Journal of Clinical and Diagnostic Research highlighted that eating guava without its peel reduces sugar absorption, keeping blood sugar levels in check. Another study featured in Food and Function showed that regular consumption of guava could lower fasting blood sugar levels and improve insulin sensitivity. These findings make guava a scientifically backed option for diabetes management. To maximize its benefits, it's important to consume guava the right way. Eating one medium-sized guava, approximately 150 grams daily, is an ideal portion size for diabetes management. If you're eating the fruit whole, consider peeling it, as some studies suggest that removing the skin can further reduce sugar absorption. You can also slice guava and add it to salads, smoothies, or yogurt for a nutrient-packed snack. Alternatively, making guava tea by boiling the leaves in water is another excellent way to enjoy its benefits. 4. Oranges. Oranges are an incredible fruit for people with diabetes. Not only are they naturally sweet and refreshing, but they are also packed with essential nutrients that support blood sugar control and overall health. They have a low glycemic index around 40. This means they are a safe and healthy choice for diabetics. When you eat an orange, you're getting a significant amount of dietary fiber. A medium-sized orange has about 31 g of fiber, which plays a crucial role in slowing down the absorption of sugar into your bloodstream. This helps stabilize blood sugar levels throughout the day. The fiber also supports gut health and helps you feel fuller for longer, which is especially helpful if you're managing your weight. Oranges are also a powerhouse of vitamin C. A single medium orange provides over 70 milligrams of vitamin C, which is almost 78% of your daily requirement. This vitamin is a strong antioxidant that helps reduce inflammation and oxidative stress, both of which are commonly linked to diabetes. Additionally, oranges are rich in potassium, offering around 237 milligrams per fruit. Potassium is essential for maintaining healthy blood pressure and supporting heart health, something people with diabetes need to prioritize due to their increased risk of cardiovascular issues. The natural sugar in oranges shouldn't worry you. Despite their sweetness, a medium orange contains only about 12 grams of sugar and 62 calories. The sugar in oranges is balanced by their high fiber and water content, which ensures that your blood sugar rises gradually rather than spiking. This makes oranges a safe and satisfying way to curb sweet cravings without feeling guilty. To get the most benefits from oranges, it's always better to eat them whole rather than as juice. The fiber is concentrated in the flesh and pith of the fruit, which is lost during juicing. Including the white pith under the peel is actually a good idea. It's rich in fiber and bioflavonoids that boost the fruit's health benefits. If you're looking for creative ways to enjoy oranges, try adding slices to your salads, pairing them with nuts for a balanced snack, or using their zest in marinades or desserts for an extra twist. You can even use orange peels to make tea. Simply boil the peel with cinnamon and ginger for a low-calorie antioxidant-packed drink, or infuse slices of orange in your water for a refreshing, naturally flavored hydration boost. These small tweaks can elevate the benefits of oranges and make them an enjoyable part of your daily routine. Oranges are undoubtedly one of the most versatile and beneficial fruits for diabetics. Eating one medium-sized orange a day is safe, meets your nutritional needs, and satisfies your taste buds. 5. Avocado. Unlike most fruits, avocado is low in carbohydrates but high in healthy fats and fiber, making it an excellent choice for diabetics. If you're looking for a way to add a creamy, satisfying element to your meals without worrying about blood sugar spikes, avocado is a perfect option. One of the most notable benefits of avocado is its high content of monounsaturated fats, particularly oleic acid. These fats are heart healthy and can improve insulin sensitivity, which is crucial for diabetes management. Avocado also contains around 7 grams of dietary fiber per half fruit, which slows down digestion and the absorption of carbohydrates. This helps prevent blood sugar spikes and keeps you feeling full for longer. Plus, the low glycemic index of avocado, essentially close to 0, means it has minimal impact on your blood sugar levels. Avocados are rich in potassium with about 485 milligrams per half avocado, which helps people with diabetes who are at higher risk of heart disease. Additionally, avocados provide significant amounts of vitamins such as vitamin K, vitamin E, and folate, all of which support cardiovascular and metabolic health. Wonder how to include avocado in your diet to get maximum benefits. You can mash it onto whole grain toast with a sprinkle of seeds, add slices to salads, or blend it into smoothies for a creamy texture. For a unique twist, try using avocado as a base for dips or dressings. Just mash it with lime juice, garlic, and herbs for a flavorful alternative to calorie-dense. Options. Another fantastic tip is to pair avocado with high-protein foods like eggs or lean meats to create a balanced meal that supports steady blood sugar levels. Interestingly, studies suggest that eating avocado may help lower LDL bad cholesterol and increase HDL good cholesterol. This is particularly important for diabetics, as they are more prone to cardiovascular complications. Moreover, avocados contain antioxidants such as lutein and xanthan, which support EY health and may protect against diabetic retinopathy. For diabetics, portion control is always key, even with healthy foods. A serving size of half an avocado per day is typically recommended, as it provides all the benefits without adding too many calories. A high fat content of avocado is healthy, but it's still calorie dense. So if you're managing your weight or calorie intake closely, you can adjust the portion accordingly. 1. Creative way to boost the benefits of avocado is to combine it with foods rich in vitamin C, such as citrus fruits or tomatoes. The combination not only enhances the flavor, but also aids in the absorption of certain nutrients like iron, which diabetics often need to keep an eye on. Avocado also pairs well with spices like turmeric or black pepper, which have anti-inflammatory properties and can complement its health benefits. So adding avocado into your diet support steady blood sugar levels, heart health, and overall wellness. 6. Cherries. Cherries are a fantastic option for people with diabetes, and they often don't get the attention they deserve. If you're craving something sweet and naturally delicious, cherries might just be the perfect fruit for you. With their low glycemic index around 22, cherries don't cause sharp spikes in blood sugar, making them a safe and satisfying treat for diabetics. What makes cherries so special is their high content of anthocyanins, which are natural compounds responsible for their vibrant red color. These anthocyanins have been shown to boost insulin production by up to 50% according to research. This means cherries can help your body manage blood sugar more effectively. Plus, they're packed with antioxidants which reduce inflammation and protect against complications often associated with diabetes, such as heart disease and nerve damage. In terms of nutrition, a cup of cherries provides about 22 Gs of carbohydrates and 3 G of fiber, which slows down the absorption of sugar into the bloodstream. They're also a great source of vitamin C, which supports your immune system, and potassium, which helps regulate blood pressure. Cherries also have a small amount of melatonin, a compound that promotes better sleep, something many diabetics struggle with due to fluctuating blood sugar levels. Now, when it comes to including cherries in your diet, fresh or frozen cherries are the best options. Avoid canned cherries in syrup or candied varieties, as they're loaded with added sugars. If you're snacking, a small handful, about half cup or 12 to 15 cherries, is a good portion to keep blood sugar levels stable. You can also toss cherries into a salad, blend them into a smoothie, or use them as a topping for yogurt or oatmeal. They add a natural sweetness that feels indulgent without the guilt. If you're looking for unique ways to increase the benefits of cherries, try combining them with foods rich in protein or healthy fats such as nuts or Greek yogurt. This pairing slows digestion further, helping to stabilize your blood sugar. Another interesting tip is to consume cherries with cinnamon, a spice that has been shown to help lower blood sugar levels. Sprinkle a little cinnamon on fresh cherries or add both to a smoothie for a diabetes-friendly powerhouse snack. Research has also highlighted the cardiovascular benefits of cherries for diabetics. Their anthocyanins and potassium work together to reduce bad cholesterol levels and regulate blood pressure, both of which are critical for managing diabetes-related complications. Moreover, shared cherries contain anti-inflammatory properties that may protect against insulin resistance and improve overall metabolic health. Cherries into your meal plan add natural sweetness and reduce sugar cravings, and their health benefits make them a smart choice for diabetics. 7. Grapefruit. Grapefruit has incredible benefits for diabetics. This isn't just a tart and refreshing fruit. It's packed with compounds that actively support blood sugar control. One of the standout components is narinine, a flavonoid with powerful antioxidant and anti-inflammatory properties. Naringine improves insulin sensitivity, which is crucial for helping your body move glucose from the bloodstream into your cells. It also activates a protein called a key player in regulating glucose metabolism and fatty acid oxidation. Essentially, this compound helps your body process sugar more efficiently, similar to how some diabetes medications like metformin work. Grapefruit is also low on the glycemic index with a score of about 25 mean, meaning it releases sugar into the bloodstream slowly, avoiding harmful spikes. The nutritional profile of grapefruit is just as impressive. A medium-sized fruit provides about 3 Gs of fiber, which plays a critical role in slowing sugar absorption and promoting steady blood sugar levels. It's rich in vitamin C, delivering around 38 mg per 100 gram, a potent antioxidant that combats oxidative stress, a major issue for people with diabetes. Grapefruit also contains about 350 mg of potassium per medium fruit, which helps regulate blood pressure. Since hypertension often accompanies diabetes, this added benefit makes grapefruit even more appealing. There's solid research backing grapefruit's benefits for diabetes. A study published in PL1 highlighted how naringin improves insulin sensitivity while reducing inflammation in the liver, a common problem for people with diabetes. By supporting liver health, grapefruit indirectly aids in regulating blood sugar. Another study from Nutrition Metabolism found that eating half a grapefruit before meals significantly reduced weight and improved glucose levels. Since maintaining a healthy weight is crucial for managing type 2 diabetes, this dual effect makes grapefruit a valuable addition to a diabetic diet. To incorporate grapefruit into your routine, eating half a grapefruit daily is a great start. This provides about 50 calories and plenty of nutrients without causing blood sugar spikes. If you prefer juice, stick to 4 to 6 ounces of fresh grapefruit juice to maximize benefits. Pair grapefruit with protein or healthy fats, like having it with a handful of almonds or some Greek yogurt. This slows sugar absorption even further, making it an ideal breakfast or snack. There are also unique ways to enhance grapefruit's benefits. Using the zest is one of the best kept secrets. The peel contains essential oils like lemon, known for their anti-inflammatory properties. You can grate it over salads, mix it into teas, or add it to desserts for an extra nutrient boost. Another idea is to make grapefruit-infused water by combining in slices of grapefruit with mint and cucumber in a jug of water. This not only hydrates you, but also gives a steady dose of beneficial compounds throughout the day. For a nutrient-packed smoothie, add grapefruit segments to spinach, chia seeds, and a splash of almond milk. It's an easy diabetes-friendly option to enjoy this versatile fruit. Grapefruit is a natural way to support blood sugar management and overall health. Its compounds like naringin, fiber, and potassium all work together to improve insulin sensitivity, combat oxidative stress, and even aid in weight management.